Live.
1, 2, 3.
Live on
Hello,
all the places.
guys.
Good morning.
Happy Monday. Right? It's Monday today, right?
Monday.
All right. Sounds good.
Welcome to our AMA.
Huh.
Guess what, friends? We're on Facebook too.
All right. So this is a
Facebook.
fancy new experiment.
This
Hello,
is-
everyone on Facebook.
Hello, Facebook. Good
So,
morning.
Facebook, Instagram,
YouTube.
Awesome.
Yeah, we really got this going on.
All right.
Oh, good.
Sounds good.
Hey, Christina, silence your cell phones.
All right.
Okay.
Happy Monday, guys.
Happy Monday, everybody.
Welcome to the Nursing School Show. Ask Christina anything.
You can ask him questions.
Ask us anything. Ask me anything. Oh, should you get the door?
Might not know the answer. I will get the door.
All right. Sounds good. Awesome. Well, this is a fancy new experiment. Welcome, Facebook. This is where Christina answers questions. I chime in at times. We will see how that goes.
Yep.
Go
Good
ahead
morning.
and post your comments
In
down,
all the
up,
places.
around.
This
Post
is
your
a little
comments
much.
up. We'll see how this goes.
I don't know how you feel about this, but this is a little much because we've got Facebook, we've got Instagram, we've got YouTube.
Looks good. Looks good.
Hello, friends.
So, all right.
Send in your questions.
Go ahead and send in your questions. We do have a couple questions that people posted before.
Yeah.
One of our things that we do with our private members of the membership community is that we allow them to go ahead and submit questions beforehand on a separate form or whatnot, and we want to answer those first. So we do have a couple of those, correct?
Yes.
And then in addition to that, go ahead and post up your questions, and we'll try and get to as many as we can. That will help as many people as possible.
That's what we do. That's how we do it here.
All right.
Good morning, Jace. Connect.
What?
Good morning. I
All
can
right.
never say these Instagram handles. I just kind of mumble. and
YouTube,
whisper.
can you guys hear us? I'd like to.
Can you hear us?
Make sure.
YouTube.
I haven't seen any comments yet. So.
Is it broken?
Yes.
Because that's totally
that is
abnormal.
that is very possible that it could be broken.
You know.
So
We break things around here.
let us know if you guys can hear us.
I break things.
How your guys' weekend was.
There
it goes.
Hi, Nancy. Good
Any
morning.
highlights of the weekend? Any highlights of this coming week? I know that you've gotten
finals.
a lot of emails because a lot of people are starting today.
Yep.
So
Did I
maybe
say
that's
finals? I said finals.
Yeah, it's not finals.
Not finals.
Not finals.
Yeah.
it's the start.
Starting?
First day,
What
second day, something. First
Yeah.
week, second week.
First week.
Let us know. That's exciting.
Let's do it, friends.
Yes.
Let's do
exactly.
nursing school this term. It's gonna be awesome.
It is.
Don't freak out. Online classes are fine. We're gonna do it. We're gonna make it happen.
Awesome.
Hey Facebook.
How do you look
Hey
at comments?
Facebook.
on
Can
Facebook?
you please comment?
Does that
Because
work?
here's the thing with Facebook.
Okay.
Me and Facebook, we're not best friends. I try to go live inside our membership community Facebook page, and I can rarely ever see the comments, which is the biggest bummer. So we do something different now. So if you are on Facebook, can you please comment so we can maybe see that you are commenting? Instagram, I'm getting your comments, so you know. All right,
Awesome.
let's dive in.
All right. So from members, did you have a specific one you want to go with
The
first?
first thing I want to do is cystic fibrosis. We
Okay.
had a member ask about overview of cystic fibrosis, what's going on, nursing management, signs and symptoms, those things. So for our nursing SOS members, we allow you guys to submit questions beforehand, before these AMAs. So it's kind of like you get 3 tutoring calls a week. Kind of cool. So cystic fibrosis, let's do it. So cystic fibrosis is primarily a genetic disorder. So genetic, mom, dad, one or the other have it, or is it like a carrier for it? Then the baby can end up with it. So cystic fibrosis is a disorder of the exocrine glands in the body. A lot of mucus production, a lot of the secretions are very thick. It's called like viscous.
Viscous.
So you might hear that word, viscous. That means thick. So secretions are very thick. So primarily it impacts the respiratory tract as you can imagine, and the GI tract and the skin. So let's walk through those three things. So the respiratory tract is really one of the biggest and really where the life-threatening issues come in, which you could probably imagine. So what kind of happens is that the secretions, right, we're constantly, like in our bodies, we're constantly producing like mucus and secretions to clear things out. Typically, secretions help us, clear through the digestive system, clear through the lungs, get everything out of the body that's not supposed to be there. However, when those secretions are thicker, they can't really move, right? Like you can't, I don't know, what's an example? I'm thinking like our 3-year-old last week just played with what was it? It's cornstarch and water.
Okay, yeah.
Have you guys played with that? It's like
and cocoa powder.
And cocoa powder to make it smell good. But it's like the craziest like feeling. I don't know. Anyway,
Yeah.
so viscous.
That's not quite the same. That's
not quite the same.
That's what you call a non-Newtonian material. So that's fun.
No, I don't know what
yeah.
that means.
But
is that the word of the day?
Yeah. What I'd like to think of is like oil in your car, right? So when it's cooler or whatnot, it's more liquidy. It's more like water, but it gets thicker as it gets. I don't know. Yeah, I don't know much about cars, but
well, there you go.
Oil.
There's your story time with Matthew time. Story time with Matthew time. Oh man, yeah. So it just gets thicker, and then so in the lungs, it's tougher to clear, right? So when like that, like anything that's like really thick, it's harder to get that out. So the issue with the lungs, obviously, as you guys can imagine, it's going to cause a lot of decreased oxygenation, cyanosis, all those things, labored breathing, hypoxia, all that stuff. Also, on top of it, though, a big thing is infections, right? So like respiratory infections are a big problem because when you can't clear out mucus and really like the gunk in your lungs, right? It's a very, very good breeding ground for bacteria, virus infections. So that's a big danger there. So that is kind of the respiratory tract. And then the GI tract, with those increased viscous, one of these days I'm going to mess up that word, viscous secretions, it cannot, like you need your secretions typically to move things throughout your GI tract. If it's too thick, it will stall out. It will cause a blockage. And so with primarily the pancreatic enzymes, they're just blocked. And so unfortunately, children with cystic fibrosis have a really hard time digesting food because the enzymes just cannot get there. They're just blocked from getting to where they need to go, which is, obviously you can't digest your food if the enzymes aren't there to help you do it. So that's with that. And then on top of that, so 3 things: respiratory tract, GI tract, and then the skin. Now the skin, this is super fascinating. When you're testing for cystic fibrosis, typically we test the skin for salty sweat. And that's because those glands, typically we reabsorb sodium and chloride back into our skin, but they cannot do that. The gene is malfunctional. That's not right. Malfunctioning.
Yeah,
malfunctioning. Yeah. Like it's a malform. It's Monday. It's Monday. Happy Monday,
Something's
friends. I don't
wrong
know English.
With the gene.
Something's wrong with the gene.
It's not working right. It's sick.
There you go. And so they can't reabsorb that back in the body. And so it just stays on the skin. And so you'll hear like cystic fibrosis, children with cystic fibrosis. I heard this in nursing school, that oftentimes they're diagnosed because their mom will like kiss their forehead or kiss their head or kiss their cheek or whatever, and it'll be super salty. Oh. And so that's how you kind of know. That's really that's the primary test for is the salt skin test, sodium skin test, sodium chloride skin test. It's also in the newborn screening.
So it's like even more salty than normal because like sweat is
way
salty,
more salty.
It's more
way like crystallized on the skin. Okay. Super, super salty. So yeah, there's that. And then as far as nursing management things too, making sure that they can digest their food is a huge thing. We don't want them to become malnourished. So enzymes, pancreatic pancreatic enzymes, and then making sure that like they're getting their iron, they're getting their good fats, because they cannot digest fat, so it just like goes out of the body. Oily stools is a big sign and symptom because they're not digesting their fats. It's just all going through the body. So we want to make sure, like, help them as much as possible to digest their food, because they just can't do it themselves. The enzymes, they're making the enzymes, but they just cannot get to where they need to go because of all the secretions, all the mucus is all blocking it. So that's how that works. So there's that. They can cause, in like neonates, like babies who are just born, what's it called? A meconium block. So the meconium is like the baby's first bowel movement, right? It's like the first, that really, the meconium is like that thick, tarry stuff.
That's the fun stuff.
That's the fun stuff, like the first like day or so with a baby. And it can cause that meconium to not be able to come out. And so that would be like a block. Obviously, we don't want that. We want the baby to be able to pass, stool and all the things. So, making sure that they are not malnourished, making sure that they have their digestive enzymes, high intake of nutrients, exercise, clearing the lungs as much as possible. We don't want them to get respiratory infection. Obviously, like we said, all that thick mucus in the lungs, all of that. So that is your high-level overview of cystic fibrosis, and that is definitely a really good one that we could do a YouTube video on. I think that would be really good. If you guys would like a YouTube video on cystic fibrosis, let me know. That was your overview of it.
Awesome.
I hope that was helpful.
Very
Did you
cool.
learn something?
I did.
Yeah.
I did.
Yeah. It's a super unfortunate genetic disorder, but it's
Is there
fun
a
to learn
cure,
about.
or is it just management at that point in time?
You know what? I have heard rumors, but I don't know entirely if there is a cure. If you guys know, let me know. I'm not sure. I just know like those treatments for it.
Yeah.
But I have heard in some of the research that I was doing, like there's like a new something or other that can help that gene to do its job. Like the gene that is broken to help do its job. So I don't know.
Okay.
Sounds fun though.
Very cool.
Yeah.
All right. Next.
Yeah, go ahead. Yeah, no, that other question, the next question from our
next
members.
up from members.
Let's do it.
What's a good way to remember measurement conversions?
And this is so funny because I don't even know, because I did not do that in nursing school, but I have had many students tell me that there is a mnemonic for it. So I'm hoping that someone out there in Facebook land, Instagram, YouTube land, do you know what the mnemonic is for? What is it?
Measurement
it's like,
conversions?
I don't know. Is it something about monkeys? I feel like it's something about monkeys.
I always just...
Do you know what I'm talking about? Instagram, YouTube, Facebook. Do you know what I'm talking about? I bet you do. So it's like that conversion, like going from like, kilograms to grams to milligrams to whatever, all throughout the whole everything. What is it? Someone tell me.
Okay.
Tell me, I'm waiting.
So that's what that is. That's what they're looking for. Measurement conversions.
Yeah, because people post about it inside our private Facebook group for our members quite often, and I think, is it something about monkeys? I feel like it's something about monkeys.
I don't know,
because there's a lot of M's there.
There is for the
millis
for the metric system.
Monkeys. So that's what I'm thinking. It's the metric system. Mnemonic. Anyway, someone tell me what it is. Someone Google it. And
related to that, though, since it is everyone's or a lot of people starting out, and very important, we talked about this last week. We talk about this constantly. We constantly get questions on it. If we haven't had a question yet, we probably will by the time this live is over. So might as well just address it now because it is in relationship to measurement conversions. But dose calc. How do you study for dose calc?
How do you study for dose calc?
Yes.
Friends, let's have a moment here. So when you are just starting nursing school, you will have a dose calc exam within the first 2 weeks of the term. So dose calc is super important, obviously, because we want to make sure that we are calculating medication dosages properly for our patients. I don't know about you, but I don't want to be the patient that goes and gets healthcare and their nurse doesn't know how to calculate your medications. That does not sound fun.
Hold on. Someone in Instagram just answered.
Oh,
King-
that's it.
King Henry died unusually drinking chocolate milk.
That's one of the ones I've heard. I think there is another one about monkeys, but that is one
King Henry
So-
could be a monkey. We can.
King Henry
Died unusually during drinking chocolate milk.
Okay, it's the metric system. That's what it is. It's the metric system, mnemonic.
Mhm.
So if you're like, what in the world did they just say? That's what we're saying. So go Google it, metric system mnemonic, and it will all make sense. I think the first time we had someone post it in the membership community, I was like,
Yeah, because they posted it with like no context whatsoever.
it was like,
They just posted up
like,
that King
that.
Henry died, and I
it
don't.
was like,
I know that King
Does
Henry
this-
is a historic figure, so I'm not sure why they
does
were
this belong
doing
in
that.
our membership
but-
Facebook? Should I delete this post?
Yes, it was interesting, but
I
yes,
know.
we did learn about it
Yeah, that was
because
like, oh,
yeah, you never use that.
no, I never used it.
I am not in nursing school. I am not a nurse, but I did do math.
'Cause we do math.
And yes,
We know
so
how to do
but with
that.
metric system, I just kind of just wrote and memorized that.
Yeah, that was what I
Um,
did too. I just
but-
wrote memorization.
Because sometimes I don't know, it each to their own. Mnemonics don't really help me out. So if it helps you out, that's great. That is one. King Henry died unusually drinking chocolate milk.
What are you gonna do?
If not, whatever works for you, that would be great. So,
yeah, if
yeah.
you can come up with another one,
yes,
I'd be all ears because I don't think I would actually use that on like a day to day. That wouldn't be like
that's
my
probably
that's
actually
probably
would
not my
help
go-to
you.
mnemonic.
That would probably actually help you remember better is if you just come up with your own.
Yeah.
And we've talked about this before, just memorization and how to do memorization, mind palaces, and really the most outlandish stuff that you can think of. It helps you the most. So you think of
Yeah.
your own mnemonic system, and as long as you know what it is and can recall it, then
That's all that matters.
that's all that matters. So make up your own if you can't find one.
Yep, that's so funny. I love it, friends. Yeah.
All right.
So that is that mnemonic. If you're like, what in the world are they talking about? Chocolate milk. Look it up. It's the metric system mnemonic. Not sure who came up with it, but it doesn't help me. Just memorize the conversions and lots of practice questions.
Yeah.
Amen to that, my friends. That's what I did too. So yeah, with dimensional analysis and dose calc, always use dimensional analysis.
Yes.
I'm not going to get on my soapbox about it right now because I already did that last Wednesday.
Check out that live
Check
if you'd
out
like
that
to
live.
listen to Christina's soapbox.
I have lots of them. Always use dimensional analysis. When you use dimensional analysis, you will use those dosage calculation conversions. And really, that's all I did was just memorize. Lena's like, it's so weird. Yeah, I know. Mnemonics are so weird. So, just make sure that you know what goes on the top and what goes on the bottom of your little railroad tracks in your dimensional analysis. You'll be good to go. That's how
Okay.
that works.
Awesome. Well, for those just joining,
Let's do it.
this is the Nursing School Show with
Welcome.
Christina. That is. No,
And Matthew.
I am Matthew.
Well, I
That's
was going to
Christina.
say your name.
This is
I was
Matthew.
just a little late
You're okay.
on the.
All right.
I was a
So
little late
it's
to it.
our Ask Me Anything. Ask
Hello.
Christina anything about nursing. So go ahead and write them in the comments. Facebook, first time we're going live with you guys. So
Welcome, Facebook.
Thanks for joining.
Sorry.
We're having technical issues with comments. We're not
I-
seeing comments. I don't think we've ever seen comments through Facebook. So
Facebook it does not like me.
Okay.
I'm really sorry about that.
So-
Because it's actually, I don't know why.
Yeah,
I don't know why
why.
Facebook doesn't like me.
I don't know.
But I can never see comments on Facebook. And so sorry about that, my friends.
Thanks for joining.
Thanks for joining, though, Facebook.
Yes.
I just cannot see your comments.
I cannot.
I cannot.
All right.
Cannot do it.
Question from YouTube. Actually, a couple questions regarding ATI proctored exams. Good morning. How do you study for ATI proctored
Good
exams?
morning.
And someone else actually asked that too. How do you study for ATI proctored exams? And in addition to that, how do you conquer SATA questions?
Yeah, SATA questions. Where's Barbara this morning on YouTube? Where's my Barbara? Barbara is my SATA question rock star.
Yes.
So, ATI proctored exams. Let's talk about it. So, ATI exams are scary. Yeah. But here's the thing. They are Good and bad in a couple different ways. The bad, I'll tell you the bad first. The bad is that they can throw anything at you. Anything. It does not have to be things that you have studied. Does not have to be anything about anything. They can throw anything at you. That's the bad. The good thing is that it mimics the NCLEX. So, if you did well on your ATA proctored exam, your HUSI exam, you know how to answer those questions. Even if you're not doing very well on them, but you get better and better and better every time, that's the key. You will do fine on the NCLEX. So if you are doing well on your ATA exams, your HUSI exams, you will do well on the NCLEX because they mimic so well. They can throw anything at you. You never know what to expect. It's a test bank. So the thing with test banks is that your instructors might not know what's coming, what's in there, what's going to be on the exam. It's like a wild card. It's like one big wild card of an exam, but so is the NCLEX. So they can literally throw anything at you, and you just got to be prepared and think on your feet. So that's the good and the bad. How to study for it is just study like we teach everything else. So whatever your professors are talking about in class, whether it's online or actually in class physically, study that, read the sections of the book that your professors talk about in class, go through, if you have access to the online ATI modules, online HESI modules, if you're a HESI program, do those online modules, online slides, do the practice questions. It is not busy work. I hear this all the time from nursing students. I didn't do the practice questions because I thought it was busy work. Friend, that's a huge mistake. Do the practice questions and read the rationales. Do not skip those rationales because they are life for you in nursing school. You have to know why you're getting things wrong, why you're getting things right. You have to know why you are getting questions wrong and why you are getting questions right. Please. So please do not skip those rationales. It's going to give you a lot of great feedback.
Awesome.
There was the second part to that question.
Yes.
Oh, yeah.
How do you conquer SATA questions?
SATA questions. Let's talk about it. So SATA questions are those select all that apply questions. Aren't those just the dream? So this is where you have your main question, you have answers, and you have to literally select all that apply. There is no partial credit. So you have to get them, it's all or nothing. You have to get all right or all wrong.
All right.
All right. All right. So got to get them all right. There is no partial credit. So here's what you're going to do. Read the question, and then go down to the first answer. And ask yourself, is that true or false as it relates to the question? And select it appropriately. And then read the question again. Go down to the second answer and do the same thing. Is it true or false as it relates to the question? Do you know what I'm saying? Then again and again, there's usually 5 of them. So select all that apply. Take every single answer on its own merit. Take every single answer individually. Do not combine them together. Take them separately, individually. Treat them individually. It does not matter if, this answer says this, but this answer says this. If they're both correct, they're both correct. They could say the exact same thing. If they're both correct, they're both correct. Select them both. Good? We all cool on that? We all cool?
Awesome.
Man, Facebook, what a bummer that I cannot see your comments.
Any from Instagram that you'd like to?
Bummer.
Did you see?
Let's see. I just joined. Sorry. Hello. If you're just joining, my name is Christina, and I am here to answer all of your questions.
Welcome.
For nursing school. I just joined. Sorry if it's already asked, but what advice do you have for first semester students with it all being online? Don't freak out. That's my advice for that. We have a whole YouTube video, actually, 2 YouTube videos on online classes, how to create a study schedule for online classes and just how to do online classes. And those are very, very good resources for you. So go to YouTube, type in Nursing SOS online classes. Da-da-da. It'll be there for you. Maybe Matthew can put it in the chat on YouTube.
I don't know if I have it. Look.
Maybe we don't have it, but it's there. Online classes. There you go.
Online classes.
Yep. So Matthew's got that on YouTube. So if you are in the YouTube chat, check out that link. Now, online classes really, I think honestly at this point, I mean, of course there's study tips for it. Of course there's like strategies that you can do, which I talk about in that video. But at this point, it's truly a mindset thing. It really is. I mean, constantly we've gotten questions from students about this, and not just questions, but students saying nursing school is now online. I'm freaking out. Don't freak out. It's gonna be fine. Like, I know it's a change, and we don't like change, but you can handle change. Tell yourself you're capable of handling change. I know you can do it.
I like that. Yeah, and I mean, it may be new now, but I mean, other schools have been doing online stuff anyway, and people are getting used to it. So it's not. It may be new to us, maybe new to you, maybe new to you. But I think just don't psych yourself out and see what's the best way of just learning and kind of adjust your mindset. We talked a lot about mindset and what's the more positive way of viewing things. I think that would be great. There is a follow-up question from YouTube that is a little more practical. I start next week. This is my second career for me, and I'm an older student. Is it better that I do traditional note-taking or use an iPad?
Traditional note-taking. Traditional note-taking every single time. I know we like our laptops. I know we like our iThings. I'm not an person. I don't have anything Apple.
No, we do not. We are Android people.
Apple. Android people. Totally don't use a laptop or technology to take notes, friends. Please do not. So here's the thing. When you are physically writing your notes out, if you are a kinesthetic learner, if you are a visual learner, that's going to help you so much, because you are physically writing it out, which is that kinesthetic, thinking and doing, writing it out. Even if you're not actually physically doing a skill, you are physically writing it out. That's very, very helpful. And then visually, you can see the words on the page. It just really helps you remember it. Then if you are an auditory learner, you can say it back to yourself, or you can teach it to somebody else. Hearing it, whether or not you are hearing it from someone else or hearing it as you talking it out, saying it, both of those things are going to help. So I really recommend that you physically write your notes out. Always. I don't think there's any other way to do it.
Yeah, I am very much like the technologies. I like the technologies.
You like the technology.
I like minimalism. I like not having anything. I like everything on my computer or on my phone or anything. That being said, I do agree that there is something about actually writing it out. Christina has a couple YouTube videos about how to take notes, which is really great.
Nursing SOS on YouTube. Go to YouTube, type in Nursing SOS note taking.
It's a really great way of doing it.
You'll find them.
And it works for both in-person and online classes. Yes. So no worries there. But yeah, there is something about actually picking up a pen and writing through things. If you want to be minimalist like me, afterwards you can always transfer it over.
Yes.
And just the rote writing again, just writing it over and over again, the more times you go through that material, the better. So it's not the end of the world to write it out and then rewrite it again on a computer or something else like that. It just is another way that you can review your material.
Yep.
So there is something to be said about actually writing it on paper that is helpful.
Absolutely. So. I think you can it really is that kinesthetic part. Hey, quick question, Matthew. Do you have your phone?
I do have my phone.
Can we get on Facebook? Because I feel bad for Facebook because we're not getting our comments, Facebook. I wonder, could you find our live on Facebook? And then can we see the comments on your phone? That's what I'm wondering.
Maybe.
Just make sure to turn your sound off. Oh, I've done that before where I get the feedback thing.
Let me see if I can do that.
Not sure who came up with it. Oh, yeah. Okay. We know we talked about that. Yeah. Any advice for mental health? Yes. Mental health is very much, a lot of it is memorization. A lot of it is compare and contrast. Okay. If you're in mental health, you probably know what I mean. A lot of things are very different. And a lot of things are very, very similar, but have some very stark differences. So mental health, when studying for mental health, what I always say is that it's very, very important that you create a compare-contrast chart. I think that is the most helpful thing to do because some things are so similar but yet so different in really critical aspects. So mental health, That's what I recommend. Also, medications. Mental health is a lot of pharmacology. It's a lot of medications, a lot of pharmacology. So that is what I really recommend that you focus on. Pharmacology, compare, contrast charts. Hey, we have
look,
Facebook
there we go.
comments. Look,
So-
people are commenting on the Facebooks. So thank you. Facebook comments, we can see you on here.
I will get there. Sorry.
Okay. In just a
There we
moment,
go.
we will find some.
All right.
All right.
Sorry. I heard you talking about the mnemonic for.
Yes.
Yeah.
Did Facebook
someone on
tell us?
Facebook has another one. Kings hate dragons because dragons can't make money.
That's great.
I like that one.
Okay.
That's a good one.
That's funny.
So again, whatever mnemonic works for you, whether it's something that someone else has thought of, or like I said, make up your own ridiculous one. The more ridiculous, usually the more it hangs on in your mind, as long as you can kind of match those two up together. So as long as it helps you.
Yep.
Then that's
hey,
all that
Facebook,
matters.
I'm so glad that we have your comments now on Matthew's phone. Sorry,
right.
we cannot see it here on my phone. So literally, guys, right now we have 1, 2, 3, 4 technologies.
It's pretty fun.
In our face.
So like I said, I like
crazy.
the technology.
Oh, and the whole computer screen too. Oh man, because Matthew tracks your comments and we have all the things.
We actually have a Facebook question.
Go for it.
And it's been asked on YouTube a couple different times, so might as well talk about that one. Any advice for med-surg?
Okay.
What can you expect walking into med-surg, and any advice how to prepare for med-surg? So lots of med-surg adjacent questions.
Lots of med-surg adjacent questions. I think we got one of those on Instagram too. So med-surg, let's talk about it. Med-surg is really where you start to take off in nursing school. So your nursing school is going to go something like this. You have your basics, fundamentals, things like that. And then you start to get into your med-surg, basic med-surg, where you are learning more of the high-level med-surg disorders, things like diabetes, heart failure, stroke, the really common ones. Then you'll get into advanced med-surg or critical care, where you'll learn about ventilators, tracheostomies, chest tubes, sepsis, pneumothorax, things like that. So you go from kind of your higher level med-surg, more, I don't want to say basic, but like higher level med-surg topics and, your first med-surg course, to then more advanced med-surg, critical care, things like that. That's kind of the progression. So med-surg, when you start your med-surg class, you're going to be learning all those disorders. And like we talk about, always focus on 4 main things: pathophysiology, signs and symptoms, nursing assessment, and nursing interventions. Those are the 4 main things that you are going to want to focus on when studying med-surg. That is what they're going to teach you on. You are not likely to be tested on pathophysiology. However, pathophysiology is the foundation of everything else that you will be studying, namely the signs and symptoms, the nursing assessment, and the nursing interventions. It is very hard to understand what is happening, like the signs and symptoms that you're going to see in a patient, or the nursing assessment you have to do to fix it, and the nursing assessment and the nursing interventions you have to do to fix it. If you don't understand what's actually happening, you have to understand the pathophysiology first. Then you can understand the other 3 categories: signs and symptoms, nursing assessment, and nursing interventions. So that is what you will focus on when studying med-surg. That advice stays the same. Then focus on studying the things that your professors talk about in class, whether it's online or in a physical class. So make sure that you are not reading the entire textbook. That would be crazy. There's too much in there. I mean, it's ginormous, and you have so many textbooks. Waste of time. Focus on studying the things that your professors talk about in class, and focus on those 4 main categories. That's it. So med-surg, that's kind of your high-level basic med-surg. You will maybe go to clinical. Can you guys tell me on YouTube, Facebook, Instagram, clinical, where are you at? What's going on for you for clinical? Are you online for clinical? Are you doing clinical hours at school? Are you going to a facility for clinical? Let me know. Tell me what's going on. Tell me all the things.
Awesome.
Where can I go to pass my entrance exam?
Well, actually, in regards to I don't know if it's regards
We'll
to that. We can
back.
circle back around on that with entrance exams, but
no, to med surg.
Or-
I was thinking like clinical.
sorry.
So tell me what you're doing for clinicals.
Oh, okay.
And virtual clinical, and we'll circle back. So go, Matthew.
Yeah. So no, next question from YouTube and other places is, I'm currently working on my prerequisites. Where can I help, or where can I find help with that? And just
We've
basically,
gotten so much.
yeah.
That's been like a consistent question the past couple of weeks.
Yep.
We've gotten in our inbox. And
Currently
stuff.
working with prerequisites.
Yeah.
What was the other one? And then this is kind of another part of another question, but do you have any videos on AMP? Because it's kind of
AMP prereqs. This one here on Instagram. What do you think about getting a CNA job before nursing school? We just got a lot of pre-nursing school questions. So I do not. Where can I go to help pass the nursing program entrance exam?
Yeah.
So a lot of you guys are not even in nursing school yet. You're taking your prereqs. Or, I mean, you might be in nursing school, but not in your core nursing classes. So prereqs AMP is a lot of memorization. Anything that is rote memorization, you guys, this includes things like a lot of fundamental stuff that you'll take in nursing fundamentals. A lot of that is memorization too. Like we said, mental health, some of it, infectious diseases, like the immunity schedule, the vaccination schedule for pediatrics. A lot of that's just memorization. So anything that you just need to memorize, flashcards and whiteboards. That's the key. That's the dream. Really, whiteboards make your dream work. What is that?
That's a nice saying.
Hard
you
work
should put that on a
dream
shirt.
work. Put that on the shirt. On a shirt.
Whiteboards make your dreams work.
Whiteboards make your dreams work.
I like
They do. Flashcards and whiteboards, my friends. Flashcards. I need a shirt that says that. Flashcards and whiteboards. Can someone please make me a shirt? Flashcards and whiteboards. Do it. Because that is really the key for memorization. Anything that you just need to memorize. That's it.
And shout out to pre-nursing.
Pre-nursing smarter, Kate. For the TEAS test. If you have to take the ATITs test for an entrance exam, there's a bunch of different nursing entrance exams. I probably should have clarified. Friend on Instagram, Stephanie. Hi, Stephanie. Where can I get help to pass the nursing program entrance exam?
Yeah.
It depends on what entrance exam you have to take because there's different ones. So one of the most common ones is the ATITs exam. And so my girl Kate over at Pre-Nursing Smarter. So at do you see my little A? At Pre-Nursing Smarter over on Instagram. Check her out. And her website as well as prenursing-smarter.com.
At Pre-Nursing Smarter.
Check that out.
All right.
She's awesome. Yeah, we got so many med-surg questions, you guys. Who's all heading in med-surg? Hand up. Raise your hand.
Let's see on Facebook just to get
some
some people
cancel.
updated.
Instagram, I almost canceled you. So sorry, friend. So sorry, Instagram.
There are actually some people that are placed in a hospital.
Woo! Very nice. That's awesome.
Clinical hours at school, busy work with mannequin scenarios.
Oh, busy work with mannequin scenarios. Let me just tell you something, friends. I would much rather you work on a mannequin before you work on me as your patient in a hospital. Not busy work. Please, 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 like, take that seriously. Take your clinical scenarios seriously, even if it's in a lab, even if it's in your skills lab. Get it right on a mannequin first before you do it on me.
That's a good point.
Sounds like good advice,
that's
right?
a valid point.
Yeah. As of right now, we will have labs and clinicals. That's from Tiff.
Okay. On YouTube, half clinicals in hospital, other half online case studies. So that's cool.
Virtual clinical for Emily. All right, you guys got all the stuff. Yep.
All right. For those just joining, welcome to the Nurse in School Show. Ask me anything. Ask Christina mostly anything. Ask me next to nothing. And we'll be good.
And we'll be good.
Go ahead and post up your comments, and we're trying to get through as many as we can. There's a really good question from YouTube.
Go YouTube. What's your question?
I actually graduate in 6 weeks. How would you say that the current situation of our world I'm not going to say what they actually said, but
Yeah.
you can figure it out.
YouTube does
You can
not
figure
like
it out.
those words these days.
How has it impacted new grads when it comes to job hunting? Also, any new advice for new grads? There's someone else that asked, I think last week, and we weren't able to get to them, but I want to throw this in here too, because it's related. I'm pretty discouraged about job placement because my career service department says hospitals only hire into residency programs, and I could only apply to home health or a non-hospital job. That's not what I want at all. Have you heard of this before? So basically, what do they do after they graduate?
Christina?
Oh, is this a soapbox moment?
Soapbox.
Yes. We at least get this once alive, so you're in for a treat.
You're in for a treat.
There you go.
All right, let me just step up here on my soapbox. My friends, if the world tells you that you can't, you turn right around and you say, watch me. So what I gathered from that question is that you've had instructors, you've had other nurses, you've had nursing students, you've had the world, everybody out there that tells you that, hey, you know, right? Like, you know, someone's told you that you can't get a job after you graduate nursing school. Like, someone's told you that, right? Like, the world has told you that you have to go into a residency program or you'll never be able to be a nurse. Like, the world's told you that. Such a lie. Do not listen to the world, my friend. If someone tells you that you can't, you turn right around back to them and say, watch me. Watch me do it. Watch me make it happen. Watch me do this, because I'm going to show you that it can be done. And then do it. So it's just such a lie, and it bothers me. Can you tell? I get dramatic about it. I get dramatic. It bugs me when people tell me that I can't do something. That bugs me. Like, mind your own business. Watch me make it happen. That's just my personality. I don't know about you. Apparently, people agree because I'm getting a lot of hearts on Instagram right now. Thank you, Instagram. So this happens a lot with new grads, and like, people just tell you, like, you know, right? Like, you know that you have to do med surg first, or you know that you have to go in a skilled nursing facility first. You have to work long-term care. You have to work hospice. Like lies. All of them lies. I have had friends in nursing school and just friends that I've just had who I didn't go to nursing school with who, like, didn't work long-term care before they went and was a med surg nurse. Like, you can do whatever you want. You know that, right? Like, you can do whatever you want. There's no rules with that. Like, you can go find whatever job you want as long as you're qualified for it. As long as you could do the job, like, do it. Make it happen. Get the job you want, friends. Don't let the world tell you that you can't. That's such a waste of time to listen to other people. Like, such a...
Don't listen to other people.
That came out wrong. But it's, I mean, you know what I'm saying, right? If someone is telling you that you cannot be who you want to be, do what you want to do, reach your dreams... If someone is trying to hold you back, like, don't listen to them. Come on now. Just don't do it. You should see the emails we get every week. People are like, Christina, you're too much. And I'm like, thank you.
Too much hand movements.
Hand
waving.
People don't like my hand movements, apparently.
So, yeah, I definitely get that.
Still here. Still here. You get that you don't like my hand movements?
No, actually, I find that I move my hands a lot more now too. So
yeah, for sure.
It helps to get the idea across and to get the words out of your mouth. Out of my mouth, anyway.
There you go.
So
there you go. There's your hands movements for the day, YouTube haters.
No,
there you go.
I was gonna say, yeah, I get the, yeah. If people tell you can't do this, can't do that. Definitely take it with a grain of salt, I'd say, and figure out a way. You can always figure out a way.
Jam on that. Hang on.
I'm gonna jam on that. Where? Okay. All right. Yeah. So just figure it out.
I have a treat
You
for
might
you.
not.
I have a treat.
What can I say? There's always a way. Think outside the box.
Yes.
And make it happen. So I get that with one of the questions. I was just wondering, after you show this and after you go through that,
I have a treat for you guys.
kind of backing up to the first question or first part of that question, is there any like practical things about like what to do when graduating or after graduating?
Am I to answer that now?
You can show what you were going to show.
This
show that.
Is in our video studio as a constant reminder to me to keep going. Hustle until your haters ask if you're hiring. Can I get an amen? Can you see this, Facebook? Can you
go.
see it, YouTube?
Oh.
Hustle until your haters ask if you're hiring. This might be backwards. There's a very good chance
it's backwards to us, but
backwards.
it's right for them.
Is it right for you?
Yeah, it's right for them.
Screenshot it. Screenshot this. Pose. Screenshot it. Hustle until your haters ask if you're hiring. If I had listened to every single email that I get that's like just curse words at me, I mean, I don't even know where those come from. YouTube comments, I don't know. I don't get very mean comments on Instagram, so I can't really say Instagram. Facebook comments, Facebook. Let me just tell you. If I listened to that, friends, where would we be? I would not be helping you right now in nursing school. Let me just tell you. Good thing I didn't listen.
They're laughing because yes, it is backwards. Sorry,
Instagram.
It is backwards.
Sorry, Instagram. Probably sorry, Facebook too. But you know,
well.
Can't you like reverse? Thanks for reading it. Can't read backwards. Sorry, Gabrielle. I love it. There's my soapbox.
To answer directly, would you say that this current environment has impacted new grads? I would say yes, it has impacted new grads, but so has everything else in the past too. Everything is constantly changing. Everything is slightly different for new people coming out as graduates.
Right.
So has it impacted more? Maybe, maybe not.
Your NCLEX is shorter. Congratulations.
When it comes to job hunting. So, yeah, it definitely has impacted it. Has it impacted it positively or negatively? I guess that more comes out to your view set. We talk about this a lot. It's mindset. So look for the jobs that you want, hustle, and make it happen. Think outside the box. Think about ways of getting it and making it happen. Let's
just leave this here. We can cut the live now. We'll just leave this sign. Hustle until your haters ask if you're hiring. Friends on YouTube, Facebook, and the Instagrams.
I do know that we had a question kind of like this for our private tutoring in the membership a while back.
Community.
And our manager,
community manager Nicole talked about it.
Actually came on and talked about it.
Yep. I think a lot of what she had said was ask a bazillion questions. Like when you get on the floor as a new grad, ask 1,000 questions. That's what she had said in her thing. Which goes for clinical too. Like when you are in nursing school, ask 1,000 questions every day. Every day. Okay, so we get a lot of questions about online classes. Friends, if you are in online classes, which like, come on, like all of us are right now. Not me. I'm not in nursing school anymore, but like I identify with you. So we're all in online classes together. So ask your instructors a gazillion questions every single day. This means that you email them. It's totally fine if you cannot physically walk into their office. That's totally fine. They're still available for email. Email them constantly. Always. Get to know them. Ask how you can support them. There's a concept. Be nice to people. Just be nice to everybody, including your instructors. Man, Christina's sassy pants today. Do you like my sassy pants? Okay, can you guys just tell me? Is it a little too much? Is my sass a little too much? Am I a little too direct? Because I have heard this both ways.
Yeah.
I can see how some people would think that I'm too direct and a little too sassy. But I could see that some people love it. I would love it. So this is kind of how I teach and how I coach other people. I coach how I would want to be coached. And I like to be coached with a little bit of sass. Like I just need somebody to kind of kick me in the pants. You know, you see what I'm saying? So I'm here for you to kick you in the pants. You know, hey, I'm getting a lot of hearts on
All
Instagram.
right.
So apparently people think my sassiness is awesome and worth the hearts. See, people say they love it. I don't know. Gabrielle says she loves my honesty.
Awesome.
Honesty is the best policy. Is that the phrase?
Rhyming is the best policy because then people remember it more.
Yeah.
Yeah. So any more tips on that is found in our membership community.
Yeah,
we do
Nicole had a
have
big thing
a
there.
private tutoring call that you guys have every week that you guys kind of dive into that a little bit. Talking about our membership community, it is now closed right now, but
Yes.
if you do want to join the membership community, go ahead and join the waitlist.
The secret's out, friends. It's opening very soon.
Uh-oh.
So.
It's opening very soon.
So.
I guess that's a secret that is no longer a secret. It's a half
Wink.
secret.
Wink. Join the waitlist. Wink. The Nursing SOS membership community is opening soon. Wink. For fall. Wink.
So there you go.
Every day we get students that are like, wow, let me in. Please. So, wink. Join the waitlist. Sonia says, I think you're passionate. That's what I would call it. Thank you, Sonia. I really appreciate that.
It's a good way of putting it.
Passionate. That's me. Passionate about nursing. Passionate about life. Emily loves it. It's great. Thank you. What is Facebook? Right. Does Facebook love or hate me?
Facebook, let's take a look.
I feel like Facebook always hates me. I can never get Facebook to work. Yeah, I just can't. Ugh. Facebook locked me out the other day.
Mention anything except that their sign was backwards. So.
Okay. Their sign was backwards. Sorry, Facebook. I love your sassy because I'm sassy. There you go. Thanks, Instagram. Instagram is all the hearts today. Sorry, Facebook, that I cannot see your comments on the screen, but Matthew has them on his phone.
I do. So if I'm looking down, that's what's happening.
Yep.
So, all right. Let's see. Another question to field.
Do it.
Asked a couple times. Let's see. Where is it?
Did anybody notice that we didn't post a YouTube video last week? By the way, it's coming tomorrow.
I noticed because I edit it and I'm still editing.
By the way, it's coming tomorrow and it's good.
Okay.
Watch it.
I'm new to your channel. Oh, wait. Okay. Maybe I'm reading this wrong.
Where did this go?
Yeah. I got a lot of tips. So I'm not sure if this is said that because they joined the channel, they got a lot of tips from us about pharmacology or is asking for a lot of tips about pharmacology. But let's just go with that. What are some tips with pharmacology? Because people have asked numerous times during this live. So we talk about it pretty much every live.
Always. Yeah.
But
pharmacology is a big deal.
Yes, it is a big deal. So pharmacology, help. Go.
1, 2, 3, go. So there was also a question that I saw on pharmacology in the NCLEX and how to study. Did you see that come through?
Yes.
I saw that like before. Pharmacology and the NCLEX. So let's talk about both of those together. So when you are studying pharmacology, you need to study the mechanism of action, preferably for the drug class. And here's why. The drug class is a group of drugs that act the same way in the body. And this is specifically the pharmacologic class. Group of drugs that act the same way in the body. Every medication within a pharmacologic class acts the same way in the body. It has a very similar chemical structure, acts the same way in the body. That means that the side effects are going to be very, very similar. Nursing assessment, similar. How you give it, nursing considerations, intervention. So study the mechanism of action for the drug class, and then you will automatically know what the mechanism of action is for each individual drug within that drug class. How many times can Christina say drug? I put out a YouTube video, this was a few months ago, on how to learn medications faster. Highly recommended, by the way. Go look up that video. Nursing SOS, like go to YouTube, type in Nursing SOS medications or Nursing SOS pharmacology. Anyway, that video, apparently people find it because they Google how to make drugs. Like, do not talk about that in this video.
Yeah, yeah.
well, I don't know what you're searching for.
Spoiler alert, we do not teach you how to make drugs.
No.
This is
we just
not
teach you
Breaking Bad.
Pharmacology. So, learn the mechanism of action for the drug class. Now, with the NCLEX, with ATI, with your nursing exams, with anything like that, they're going to include the generic name of the medication. There's a lot of different names for medications. Generic name, there's only one. Trade name or brand name, there's a bunch. So you need to know the generic name of the medication because that is what they're going to remember you on. Test you on.
Remember you on.
Learn the generic name. Remember the generic name. Don't you can know the trade names, obviously, but you need to know the generic name. Focus on remembering. That's what it was.
That's what you were remembering.
That's what I was remembering. Make sure that you know the generic name of the medication before you go to your exam. Oh, Instagram, I love you. You're the best. All the hearts. I just love it. Drink every time,
that.
Christina.
That's a fun game.
Oh, Instagram. That's funny. Instagram. You are the best. What would I do without you? I tell you what, it's almost 10 o'clock on a Monday and I'm fading. I feel like I am just tired. You guys are so tired sometimes.
It happens sometimes.
Yeah.
Well, what did we say last week? We just push through it.
Push through it. Motivation,
So,
you don't need it. You just need dedication for God.
Yes.
And coffee.
And that's a good reminder since a lot of people are starting or just getting going. So remember your why.
Mm-hmm.
Remember why you're doing things. Yep. And motivation is not everything. Motivation comes and goes, but you need something stronger than that to keep pushing forward.
Yep, absolutely. How to handle separation anxiety with the kids.
I saw that.
Can I talk about this?
Yeah, go ahead.
I don't think people are going to like my answer. So that's why I'm a little bit nervous about this. I don't know if you're going to like my answer or not. Separation anxiety with the kids. How to handle going to nursing school and being away from your kids, especially if they're little. Okay, here's the thing. I cannot tell you honestly if I would have gone to nursing school with little kids. To be honest, I probably wouldn't have. And I don't think people are going to like that answer. But honestly, I probably would have waited. So that's my answer. It's up to you. You have to get very clear on what your priorities are. Very clear on what your priorities are. If your priority is not nursing school, then it's probably not a very good time to go to nursing school. If your priority is nursing school, then yeah, sure, you can. You just have to go into it knowing that you're going to have to sacrifice time with your family. For us, I did sacrifice time with just my family. It was just him and friends and extended family whom we are very close with, family. We did not have kids in nursing school. And I can't honestly say, I just genuinely, I truly believe, like, would you back me up on that? I probably wouldn't go to nursing school if our,
I would agree with that. Yeah. We are in a different place now than we were when you were going through nursing school. I do say it kind of lightheartedly, but it is true that when we decided that you go through nursing school, it was just me. Mm-hmm. We knew what season we're in. And I think that's the other point that I just wanted to get across is that it's all this whole idea about work-life balance it's true, but in a way that I feel like not a lot of people really push for. It's a work-life balance in seasons. So recognize what season you're in and determine what season you want to be in as well. So nursing school does take up a lot of time. It does take up a lot of energy. So just decide what your season of life is going to be. Yeah. And along with that, something else that we talk about a lot is mindset, working with your mindset, working with yourself, and becoming clear with yourself what your answers to those questions are. Yes. Really, the anxiety and stress comes from the fact that you're not in total alignment with what you're doing. So becoming in total alignment will help a lot with that.
Yeah.
So whatever
mommy guilt stuff.
Yes. Whatever you decide on that. And you have posted a couple of YouTubes, one about mommy guilt, not you to mention it, that
Yeah.
was quite a while back. But then you also did post something just a couple of weeks ago about priorities.
Yeah, priorities and kind of that work-life balance. So go to YouTube. I think it was the study schedule one. YouTube Nursing SOS study schedule. Okay, sorry, Instagram. We only have an hour with you, and Instagram's telling us goodbye.
We're
so
gonna drop off.
I hope that was
bye.
helpful.
Thank you.
Instagram. Bye.
For
Bye,
those of you guys on
Instagram.
YouTube and Facebook, we can continue talking about it a little bit.
Yeah,
but
I think this is a big deal. I cannot. So that's the thing. That's really the thing that I don't think people would expect to hear. Maybe not expect to hear from me. Expect to hear from other people. But you have to know your priorities. And in this season of life, whatever season you're in, if nursing school is not your priority, if you've got little kids at home, you can ride it out for a couple years. I mean, that's fine. Wait till your kids are school age or older to go to nursing school. Nursing school is always going to be here. It's always going to be here. But if you know that this is what God wants you to do, He wants you to go to nursing school now, and then, so whatever the plan is for you, you know that, then do it. Follow that. But the thing is, for me, I don't think I would have.
Yeah. So it is a
I would have waited.
It is a very personal question. It's a question that you need to pray about and ask God about on what season you are going to be in, what He wants you to do.
Right.
But definitely it is not popular with what you were just saying, that it is okay to wait, or it's okay to put one thing above the other, or you can have your pie and eat it too. And not to say that you can't do everything. With God's help, you can do anything. You can do everything. You can have little kids and go through nursing school if that is what God has planned for you. That is 100% a possibility. But you need to be in alignment with your belief structure. You need to be in alignment with your mindset so that you can move forward with what you're doing with a clear conscience.
Right.
That this is what God has made me to do. And this is the season of life we are in, whether it is in nursing school or whether it is, you know what, I'm going to put this off for a little while and be with my kids. Another thing that's really interesting, I follow Rory Vaden a lot. He's a great brand speaker and just business leader,
Yeah.
motivational speaker.
He's the CEO of Nursing SOS, by the way. Did you guys know that?
This one, yeah.
He's the CEO. Oh, you, and not
one. No.
You are the CEO.
So,
I don't know if you guys knew that. Actually, I am not the CEO. He is.
So I follow him a lot,
saying.
and he mentioned actually something really, really funny, that look up priority in the dictionary, and what do you find? That priority in its original form, there is no plural. There's no priorities.
Oh, yeah.
There's only one priority. So determine what your priority is, and that is your one thing that you're doing, the one thing that you're going to strive for and do. Yeah. So that's kind of a misconception or conflation of using the word priorities, but I like thinking about it as, what is my one priority, and what am I in the season of doing right now?
Yep. So if nursing school is your one priority, you just have to go into it knowing that you will have less time with your kids. You will have less time with your family. And if that is okay with you, then go for it and go all in. If that's not okay with you, make sure you recognize that, and maybe you put off nursing school. It's an absolute possibility. That's totally fine. Don't let anybody tell you, again, like back to what we were talking about like an hour ago. Don't let anybody tell you what you can or cannot do. And it goes both ways. If someone tells you that you need to go to nursing school now, challenge that. You don't have to go to nursing school right now if you don't want to. Like, if you are in this season of life with everything happening in the world, I was just having a conversation about this with our members. If you are in a season of life right now where you are homeschooling your kids because they are not in school anymore, if you cannot go anywhere outside of your house, if you just lost your job, all of these things, and you want to go to nursing school right now, like, just, if you feel like you have to go to nursing school because everyone is telling you to go to nursing school, but at the same time, you just lost your job, your kids, you have to homeschool them, you know, your husband's home, you know, what have you, maybe now's not the time. Maybe we can just consider that now is not the time. I just want to offer that to you. Like, I just want to offer that to you, that you don't have to do anything that you don't want to do. Nursing school can wait. It's fine.
This kind of goes back to what we were talking about earlier. Don't do things just because people tell you to do it, or don't do things just because you feel like the world wants you to do this, or that you have to do this. You need to do it because you are in alignment with what you're going to be doing.
And what God wants you to do.
And what God wants you to do.
Yeah, absolutely. Absolutely. I do believe that oftentimes we get calls. If you're on our email list, you got an email from me last Friday because I specifically had something on my heart that I needed to share with you. And so yeah, if you're on our email list, you got that. But also another one for me is like, we just have to be very in tune with what God wants. That's the question we need to be answering. Asking, what does God want? And then seeking that answer. You know, what does God want? So for us, we have decided to homeschool our kids outside of the whole world situation. Like, we made this decision years ago. Not because we wanted to. I never thought I would be a homeschooling mom, but God put that on my heart. And he said, Christina, you need to work on your patience. And this is how you're going to do it. And so that is like hard for me because I don't want to. Don't want to do that. Like, when that happened, like when I got that from God, it was like, no, I do not want to do that. Why do I need to do that? And there's a lot of pushback, right? I have since come to terms with it, and it sounds fun. But at the same time, like, we get those calls sometimes. If God is calling you into nursing right now, do it. If God is calling you to stay home with your family right now, do it. You know, we need to be asking the right questions, and always the right question is, what does God want? Always. That's always the right question to ask. What does God want? The end.
Awesome.
I think that's a great way to end a Monday morning live AMA.
Thank you guys for joining us.
We'll be back on Wednesday.
We'll be back on Wednesday. Facebook will be back on Wednesday as well. So we'll try and refine some things. There are a couple questions that we were not able to get to that I have captured here. Questions about maternity. We talked about it earlier in the video or in our live, but we'll talk about it again, more about dosage calc. Spoiler alert, use dimensional analysis, but you can go back through this AMA, and I think it's the AMAs from last week too that we went into detail about dosage calc.
Yep. Was it this
one?
Benita on dosage calculation.
Yeah,
no, this
dosage
is
dosage and calculation. So we'll probably talk about that more on Wednesday. There were questions about maternity. I've noted it down on Facebook, so maybe we'll get to that on Wednesday too. So we'll see you then. Same time, same place, same people.
Sorry, Facebook. We just can't see your questions on here, but we can see it on Matthew's phone. So
I'll start that at the beginning on Wednesday as well. So go ahead and keep commenting. Also on YouTube, we have posted the one on Wednesday up already. So if you want to ask your questions there, we'll get those right before it starts. Yes. So definitely do that.
Yeah, so I'm going to try to do it earlier. So there will be like an upcoming live video on YouTube every week. So like we do it Mondays and Wednesdays. So hopefully we will have that video posted up on, it'll say like upcoming live stream or upcoming, upcoming live, whatever. Then on that video on YouTube, you can, before we go live, you can post in the chat or post in the comments your question to get it in the queue for us. So that would be... it's one way to go if you would like to get your questions answered. If you are a Nursing SOS member, you have your own form. You probably know where to find it. I email it to you and things, so you can fill that out, and we give our Nursing SOS members priority. So just like we did today, we will answer our members' questions first.
Great.
Thanks for hanging out with us, you guys.
Thanks, guys. We'll talk to you later.
Bye.
Bye.
All righty.
Where do I press it? End stream. Are you sure? All right. Bye-bye.